Very good morning everyone. കൊല്ലം കണ്ടവന് ഇല്ലം വേണ്ട എന്നാണ് പറയുന്നത്. അപ്പോൾ കൊല്ലത്ത് വന്നിട്ട് എല്ലാവരും ഹാപ്പി ആയെന്ന് തോന്നുന്നു. So let's start our first session, second session of this day, Navigating Mental Health Challenges, a practical guide for busy ophthalmologists. So as we all know, the ophthalmologists here work in high pressure environments, sometimes struggling to find the perfect job opportunities, especially when you are a junior, juggling financial issues, complex surgical procedures, steep learning curve, workplace demands and patient concerns, all while striving to maintain their own well-being. So this course practically provides practical strategies for maintaining the mental health challenges that arise at different points of life, like a budding surgeon, mid-career issues and problems faced by the veteran surgeons. So we'll be having few key topics like recognizing signs of burnout, fostering resilience, integrating mental health conscious practices into daily routine, and also we'll be sharing few tools and exercises for managing stress and mindfulness. Through expert insights and interactive discussion, the ophthalmologists here who are attending here will surely gain tools to support both their complaining patients and themselves. So first talk for today is by Dr. Jayaprasad Bhaskaran. As we all know, Sir is the Medical Director of Amardeep Eye Care Hospitals at Kollam and at Trivandrum. And Amardeep Eye Care is one of the top hospitals in Kollam. Sir, because of his long years of experience, will be the best person to talk about the mental health issues that are faced by a budding surgeon versus a veteran surgeon. Over to you, sir.
Okay. Yeah. Thank you, Dr. Aki, Thomas, Aishwarya, Ambika, and friends. Welcome to Kollam. Ophthalmology is a thriving field, offers the excitement of continuous innovation with a high degree of patient satisfaction, with more controllable working schedules compared to other specialties. But if you look at the change that has happened over a decade, we see that the practice of medicine has changed. Ophthalmology practice has changed from a surgeon or a physician central system to a more controlled system, where you have business administrators, we have insurance people, even the government interfering, telling you what exactly is to be done in your practice to the patient. Mental health issues in our practice we see is a growing public health concern, and among doctors affects the doctor's personal and professional fulfillment. It impacts indirectly on the care of patients, and there is always a backlash on the family or society. There are three aspects: burnout, anxiety and depression, which we see very commonly. Burnout is you get after a long day, stressful day, you become irritable, loss of energy, lack of concentration, and then you have this compassion fatigue, which simply means you lose that kindness and compassion for the patient. You question the value of the work that you are doing, and you don't realize how much of an impact you can have on the patient, and then slowly starts questioning your skills and abilities. And please remember that 1 in 3 suffer from burnouts, and female doctors are more affected than males, almost twice. The drivers behind creating burnout in a surgeon were poor job satisfaction, high stress, lack of control over your workload, and increased time burden for documentation. You spend more time on the computer, on your EMR, rather than looking at the patient's face, looking at the patient's eyes and talking. And then of course the systemic factors like insurance companies, administrative tasks, and the EHR really makes you struggle with less face-to-face time with our patients, and patient care gets compromised when it comes to putting everything in detail on the EMR. Please remember that women are better. They will always report their stress. Men are bravado, so they will say, no, I have no problem. Even if they are almost tipping and going down, they'll still say, no, I am strong. 40% of doctors suffer from depression and anxiety, and it's also because of the long working hours that you have, inadequate rest, and a very high occupational demand creating stress. For the younger generation, it's always the urge to reach the top. And for the people who have reached the top, it is always, when am I going to go down? That stress is always there in the back of their mind. Their memory is almost half occupied by this single thought. And this stress is exacerbated by lifestyle disorders like inadequate sleep, lack of physical exercise, improper diet, and then you always be on your reels and YouTube and all 3 hours no sleep. So you sleep at 1 o'clock in the morning, getting up at 6 o'clock, no exercise, go straight into the hospital and then shout at the sisters and patients and the bystanders and creating issues for yourself. So workplace conflicts increase, your complication rates will increase. And then of course, to compound all this, we have the VIP patients coming in and then all hell breaks loose. You have a lot of issues, and even if you have a small issue also, they will highlight. Then they'll sit outside in the OPD and talk to 100 of your other patients and create problems for you. That increases stress. Apart from that, there is a lot of expectations, financial and otherwise, from the family and the society. There will be this problem at work will be carried home, and then you will have conflicts in the family. And there is always the stigma associated with a mental problem. You cannot tell somebody that, then that fellow will say, oh, that doctor has a small psychiatric problem, please don't go to him. So you lose your practice. So that is also there in the back of every person's mind. In a young doctor, it's a work under pressure, large volume of patients, limited time, limited resources, and there's always a pressure from the management to perform. Every month they will see there is one hospital where they say you are occupying 5 square meter of this hospital. What is the amount that you are earning for the hospital? So you are under stress. There is also the learning curve involved, financial uncertainty, cultural norms which prevents you from openly discussing what is in your mind, and there are gender specific expectations, and there is always, as I said, pressure from the management. And for the old, it is a gradual loss of cognitive abilities, not willing to retire, not saying full stop, and lack of alternate hobbies. Now, once you stop practice, looking at a vacant wall and sitting just like that creates more issues for these docs. And then, of course, the gradual setting in of multiple physical ailments. So, mental health issues, irrespective of age, includes increased attrition, diminished empathy for the patient, clinical error starts increasing, and there will be an increase in the doctor-patient conflict. Please remember, health of the doctor is a public health issue and is crucial for the well-being of the doctor as well as the patients whom he or she treats. In medical colleges, we were never taught how to take care of ourselves. There was never a course on stress management. There was never a course on nutrition, sleep or exercise. I still remember learning the size of the septic tank, but never this. So what can we do? Let us listen to Thomas Cherry and Raki, Ambika and Aishwarya as to how to tackle our mental problems. Thank you, my dear friends. Thank you.
Thank you, Dr. Jayaprasad, for that introductory talk and what all mental health issues we are facing in our day-to-day practice. Do we take up questions now, or do we go to the end?
If they have any questions, we can take up, sir.
Any questions to Dr. Jayaprasad? Yes, as Dr. Jayaprasad said, something which I would also like to go with him, always have an eye-to-eye contact with the patient and not on the computer. When the patient comes to your consultation room, never look at the computer or never look at the book. So do that beforehand. Be ready with the patient data once the patient walks in. So that takes off a lot of stress from you, because you know what the patient is, what he or she is having when he walks into your room, and then start talking. Okay, it's over to Raki. Raki will be talking on optimizing time and work-life balance for the mental well-being.
Good morning, everyone. I'm Dr. Raki Dictus, and I'll be talking on optimizing time and work-life balance. So what is work-life balance? This is an art of maintaining a harmonious personal as well as a professional life. but it needs a conscious management of your time and energy to meet both physical and professional commitments while prioritizing your own self-care and well-being. So for that, you need to set the boundaries between your work and personal life by defining the specific working hours. Finding the me time, that is giving importance to oneself, the activities that nourishes us as humans, like spending time with our family, spending time with our friends, and engaging in personal hobbies. This is very important for our own mental well-being, and we always ignore this. So time management is basically the key to success. So if you want to manage your time, you need to plan ahead. You can plan in the night before or plan first thing in the morning. For every day, set 3 to 5 priority tasks, not more than that. It is not possible. Use a checklist apps. I'll be sharing few apps with you, or you can use the sticky note. Weekly review the task that you have done, that is pending and that is not done. Plan your meetings, your course, your family time. Set your personal goals. Like for fitness, I'll go to gym 3 times a week, or I'll do my exercise a minimum 2 days. Learning something new every week. Hobbies, you have to find your own time for hobbies. So I usually practice this Eisenhower matrix. This is easily available in the internet. You just have to type and you will get this. So in here, urgent and the most important things, you need to do that same day itself. Important, but it is not urgent. You can schedule it for the coming week. It is not important, but it is still urgent. You can delegate it to someone else, like your colleagues. Not important, not urgent. Try to ignore that. You should learn to ignore. Another method to keep track of yourself is by creating time blocks. So just write down the timing, the time from which you get up till the time you sleep. So this is one of my time blocks. So currently, since I am in that motherhood phase, most of my time revolves around my kids only. But then where is the time for me? You can see still there is some time for me. 8:10 to 8:25 is for exercise. 8:30 to 10, 8 to 8:30 in the night is for bathing and personal grooming. And 7 to 8 is for gym, since I have put up a lot of weight. And then I have few time for me here also. 10:30 to 12:30 is actually my own personal time where all my kids sleep, and that's where I do all my works. So similarly, there are few very good task management apps. I have just listed few. Out of this, Notion, which is available in all the app store, and To-Do List are my personal favorites. And one new app has come, Trello. I have not used it, but everybody is saying it is very good for organizing yourself. Top of everything, you need to be flexible. You should accommodate unforeseen circumstances, recognize tasks that can be delegated, but you need to build your own support system. You should tell your family the stress with which you are going, what are the problems you are facing. You should have good friends and supportive colleagues, and stop being a perfectionist. The one who are always depressed, they are actually the perfectionist. Perfectionism is not a good quality. It is actually a negative thought. So, as you all know, I am in this new mother phase, but I have a very good support system which actually helps me in moving around, which is my own parents, and a good husband who takes care of my newborn as good as me. So, out of all of this, you need to take breaks. You need to create your own personal me time for your mental peace. Minimum of 30 minutes a day you should actually keep for yourself. And taking holiday breaks with friends or family is very much important to get your mental clarity back. So I'm just sharing a practical tips for busy working women. For men, I think there is all the time. So you need to plan the next day night before. Keep your mornings for the important task, because that is the time your brain is most alert. And do batching. Set your boundaries, family or focus time, work time. Declutter your digital, that means your social media, as well as your physical spaces. Try to delegate work. Practice saying no when you're overloaded. Include your own rest and your self-care in your schedule. So, everywhere you look, you see people who are stressed, overwhelmed, and who are inadequate. So, you need to find out some stress management techniques. If you feel that you're too much stressed, reduce the noise. Do some exercise, do some meditation. You need to manage your time, and you need to get a proper sleep. So whenever there is a workaholic, what he does is he actually struggles to find that perfect practicing of self-care and finding time for the personal life. That finally leads to burnout, fatigue, and stress-related health issues. So why is being a workaholic socially frowned upon? It is because they finally have a lot of high chances of stress and burnout and mental health problems. They have a poor work and personal life balance. Because of this, they will all finally lead to divorces, which finally leads to a feeling of guilt, frustration, and resentment. Also, they will isolate themselves. They have a poor self-care and finally leads to a lot of health issues. And they have negative thoughts like perfectionism, self-doubt, and a fear of failure. And there are studies claim that a person who works for 55 hours a week finally have a high risk of stroke. Also, they can end up in mental health issues like anxiety and depression. So stop shaming people for wanting of work-life balance. I think the new generation is very much alert about the mental health. They always stress upon their own work-life balance, but the older generation actually failed to do it. They were too much focusing on their kids and their work, and they actually lacked their own self-care, their own me time, and finally ended up in a very stressful life. So let me just, this is one of the concluding remarks. Are you really successful? So you are a good surgeon, you are doing 100 surgeries per day, you are tired and exhausted, but finally at the end of the day you come home, but you are divorced, you have nobody at home, you don't have a shoulder to support or congratulate. Are you really successful? You have around 500 publications. Again, your children hate you. You have no true friends to cheer for you. Are you really successful? You are one of the fastest surgeon, record breaks, a lot of awards, but you suffer from anxiety, high BP, and you are post to angioplasties. Are you really successful? So in conclusion, use the task management apps, reward yourself for sticking with time, take breaks. So just sharing some books to read. These are two good books which can actually improve your task management and time management organizing ability. And these are few podcasts which you can listen whenever you have time. Work-life harmony and Take Back Time. These two are actually available in Amazon, and very good podcast. Thank you.
Thank you, Raki. Just now I realized that the new generation is much well organized than we people were. We were into sort of watertight compartments, professional life till 6 o'clock or 7 o'clock or whatever, then personal life and all, and you have a good way of overlapping. Raki's baby sleeping on his dad's chest. So that means men also now take care of a lot of responsibilities at home, not like what it was 25 years ago. Okay.
So I would actually say that there's a saying that behind every successful man there is a like a woman. But now I would say behind every successful woman there should be a supportive husband. That is most important.
Why the new generation is like this is because they are all well settled. The new generation, our children now, they are all well settled.
That
They
is
don't
true.
need extra money to build a house, purchase a furniture, everything. But the old generation like us now, we were working hard
True, sir.
for our life to get a better standard of living.
That is true, sir. Yes, sir. So next we have Dr. Ambika Shetty, who is the medical director at the Geethanjali Eye and ENT Hospital, Trivandrum. Other than ophthalmologist, she is a person who practices yoga and mindfulness a lot. So it is actually apt to hear from her how to improve your surgical performances by practicing yoga and mindfulness. Over to you, Dr. Ambika.
Thank you, Dr. Raki. A warm good morning to all of you. So, I'm Dr. Ambika. I'll be speaking about how you can enhance your surgical performance. You can improve your focus, you can improve your clarity and make better decisions. So, we know that the ophthalmic surgeon has a very high mental load. There is a constant visual concentration that you need to concentrate on your surgeries, and there is a high emotional demand. So most of our surgeries are under local anesthesia. Patient has lot of comorbidities. Patient is looking at you for emotional support. So along with your surgery, you're supposed to reassure and be compassionate also to the patient while you're operating. And also, most of us are operating high volumes. We are doing so many surgeries, and in the back of our mind, we have, oh, now OPD patients are waiting, something else is happening. All these things are running in the background. So there is a possibility of fatigue and attention drift as well. So why does it matter? Why should you become mindful? So we know that microscopic surgery needs unbroken precision. It's a very precise procedure that we need to do. So distraction will affect your outcome. So that is why mindfulness will improve your focus and also your composure. It's always better to be a calm surgeon as compared to a anxious or a tense surgeon. So coming to the difference between a reaction and a response. A reaction is something which is instant. It comes from the unconscious mind, and it is does not consider the long-term effects. Sometimes the reaction may be okay, but sometimes the outcome may not be good in the long term, and also it may have some kind of an adverse impact to the people around you. If you look at response is slow. It takes both it is based both from the conscious and the unconscious mind, and it is the decision comes from the prefrontal cortex. It takes into account the long-term effect. So definitely the response will be more compassionate for the people around you. So what is a fight or flight response? It is basically it is a physiological reaction to a perceived threat. So olden days, when somebody was in the forest and there is a perceived danger, there is a fight or flight reaction response. So we know that the sympathetic nervous system gets stimulated. The person can have dilated pupils, increased heart rate, flushed skin, and also a rapid breathing, which actually prepares the person for intense physical activity, and it can also cause trembling. So what is mindfulness? Mindfulness means paying attention to the present and also being in a non-judgmental way. So it involves bringing awareness and acceptance of each moment. So in the operation room, when can you be mindful? So first of all, before starting your surgeries, you can actually do a grounding breath for yourself. During the procedure, pay attention to your posture and also try to practice some micro pauses in between. And after the surgery, try to reflect on your day without indulging much into self-criticism. What is it that you learned on that particular day? So as I said, during procedures, take one deep breath before each key step. So say if you're a cataract surgeon, capsulorhexis, hydrodissection, nucleus fragmentation. These are your key steps. So take a little bit of a deep breath and bring your awareness back on your breath so that your mind stops wandering. Scan for any muscle tension. Sometimes during the end of the day, you notice that your back muscles, your neck muscles become stiff. So during the procedure itself, you try to also see if you're holding some muscles in a very tense manner, and every 10 to 15 minutes in your OR, try to reset yourself. So what about your team? So we all know that surgery is not a one-man show. It is always a team game. So before you start your procedure, you speak to your team members. You say, okay, what is this list I have today? Are there any special cases? What are the things that we need to be prepared for? If there are highly complicated cases, prepare the team for any difficult situation that may come up. And also, you need to understand your competence of your teammates. If there is a unscrubbed nurse who is who is in a beginning stage, you need to be a little more cautious how you need to support that particular individual. So coming to how can you practice mindfulness? So one of the practices you can think of is pranayama. It basically means a regulating of the breath. There are various practices by which you can start working on your breath. So it rewires your nervous system, and it brings about a balance between your parasympathetic and your sympathetic nervous system, and also it can cause an increase in the parasympathetic dominance, because of which you will feel more calm and relaxed during your surgeries. So what are the benefits? Definitely there is a reduction in the perceived stress. Whenever there's a difficult situation, you'll notice that the perception of the stress goes on reducing as you become more mindful. There is less burnout, more motor precision. There is better team cohesion, your team members who like you a little more. And also you realize that there is better memory and learning. The working memory will be much sharper. And studies have shown that there is reduced age-related gray matter loss in the cortex in long-term meditators. So also there is a stronger hippocampus which causes better cognition and memory. In my experience, I started yoga and meditation back in 2016, and I can experience a lot of joy and gratitude which lasts for me throughout the day. And also I can actually, I feel it percolates to my patients as well, because I see a lot of them being grateful and walking out of the OP. Along with yoga, I'm also practicing Kalaripayattu. So one thing about Kalaripayattu, I would say, is it reduces fear in individuals, so it's very helpful. So how to start? You can go for physical classes, you can go for online tools, and most important is to practice every day and also form support groups who can support you in your practice. So you remember that it is not something that it is not like, oh, now mindfulness is one more task. This is definitely a performance enhancing tool, and it will be very helpful for you in the long term as well. Thank you.
Thanks a lot, Dr. Ambika. One question to you. So, I'm a surgeon and I just had a PCR on table, okay. So, I know the steps, what I should follow, but right now I'm asking you, what should I do mentally first?
So, in this particular case, it looks like maybe you are not expecting PCR and it suddenly happened. So, first thing is you just step back, stop your surgery, take a deep breath, and then slowly analyze, okay, now that this has happened, what should be my next plan of action? And then about the people around you. So you have to think, how will I engage these people? Now, if you need to change your machine settings, how do I do that? You need to get new medication. You know all the steps, that's true. But yes, you have to step back, take a deep breath, analyze, and then go back. So that is the pause is very important.
So, what I usually face is I might be doing this and I might start the recovery procedures like vitrectomy and everything. But back in my mind, I'll be like, how will I face the bystanders? What I am going to tell about the lens change? These things will keep on popping in my mind that I face difficulty in continuing the rest of the surgery. So what to do about that?
Yeah, so that means you have gone to the future. You're not there in the present. So it's always like recentering. You keep bringing your focus back on your breath, and you do what you need to do now. What you need to do later, you can do that later. So it's recentering.
Thank you.
See, I would also like to emphasize a point that Madam said. What she said is acceptance. So there's a concept called radical acceptance. So that happens like, say you've had an RTA, you've had a motor accident. The more you think of why me or what, is it their fault? Are you actually able to tackle the situation? So by radical acceptance, what you mean is accepting the situation for what it is. And then, so that you can prioritize and work on your immediate, intermediate plans. How do you stabilize the situation immediately and intermediately? So just because ma'am has actually said that in the presentation, I just wanted to emphasize. Thank you.
Thank you. So next speaker is Dr. Thomas Cherian, sir. He is a head of Department of Vitreoretinal Service at Little Floy, Angamali. He is a veteran surgeon with years of experience, and as we all know, retina is a specialty with a lot of complications. So I think he's the best person to tell about how to tackle patients during complications or with poor visual gain, and how to ease your tension from his years of experience. Thank you, sir. Over to you.
Thank you, Rakhi, and good morning. When you have a complication on the table, Ambika would go for a deep breath and pranayama and yoga. Rakhi will be dealing with pure science, how she will manage the complications, arrange the vitrectomy, get everything done. All this, yes, but in the back of my mind, I would be rehearsing after the surgery, 15 minutes down the line, what am I going to talk to the patient and the bystander. So that is what we face in our day-to-day practice. Not for a vitreoretinal surgeon alone, it's there for everyone. Everyone has his or her share of complications because we are all human beings working on the body of human beings. So it can't be like machine or AI. There's bound to be some complication in our day-to-day practice. So what are all these complications? First and foremost is error from carelessness, which we have. That is a complication. We'll go into all these one by one. Second, we have a wrong diagnosis causing complications. Third, we have difficult surgical procedures where complications are expected and sometimes you'll end up with complications. Sometimes you have unexpected complications. In certain cases, your surgery has gone well, everything was fine, but first post-operative day or second post-operative day or after 1 week, you have some unexpected post-operative complication. Sometimes it's not a complication as such, but the patient's expectations go beyond reality. They expect that everything will be fine and they are not getting that desired outcome. We have to manage that also. At times we have to manage complications of a colleague or someone who has referred a patient to you with complication. And in certain conditions, patient has come on his or her own with complication by a surgeon elsewhere, either from your own specialty or from a different specialty, subspecialty. Patient did not get the desired outcome and quietly he slips away from that place and reaches you. So all these are situations which we face in our day-to-day practice. How do we manage error from carelessness? That is something which we have to be on our toes day in and day out. If you are a practicing ophthalmologist, if you are a surgeon who is operating on patients, we have zero tolerance to error. We cannot afford to operate the wrong patient. Sometimes patients have similar names. There could be 2 Abdul Qaders in your list or there could be 2 K.M. Matthews in your list. It's not an excuse. So before you start the list, always study the list. Who all are there? What all procedures are there? Look at the case sheet, study the list. Don't just operate on the patient whom the sister puts for you on the table. Study the list, study the case sheet, study what you have written, not your fellow has copied. There could be a change there also. So what you have written, sometimes you also face these mistakes, write down mistakes, but then someone points it out to you and with a word of thanks you proceed. And always have checks at the multiple levels. The sister in the ward, sister in the operating room, sister, the scrub nurse, the circulating nurse, your fellow, yourself, everyone have multiple checks, and these checks should not be like, yes, Prime Minister. Everyone should do an independent check. Now you could have the wrong eye. Sometimes you check all these, put the patient on the table, and I have faced a situation when I have rechecked the patient's eye, it's the right eye with the case sheet, went on, changed my gloves and came back and had the left eye draped and I went into the left eye. That I have faced on the table. Now the wrong procedure, there could be a wrong intraocular lens, the power calculator could be wrong, the type of lens could be wrong. Cataract surgery in patient who is posted for an entropion correction. The patient is on the table draped and you don't know what it is. And as usual you go in and do your cataract. It could be a wrong vitreoretinal procedure. Someone who has come for an anterior vitrectomy might have an ILM peel. So unless you check multiple times, be very thorough with the case sheet, be very thorough with the patient and go in, you can't avoid all this. And patient for a combined cataract and glaucoma procedure had only a cataract surgery and went out of the operating room. This could also happen. So all these, we have zero tolerance. But still, in spite of this, sometimes these errors happen. And when this happens, you should not leave it to the operating room sister or to the ward sister or your fellow to talk to the patient. You should take it up by yourself. The surgeon himself or herself has to talk to the patient because the patient has confidence only in you. Patient knows only you, no one else in the hospital. If necessary, you can take the help of a colleague or a senior colleague or an administrator, whoever. to talk to the patient, but you should be there. If it has not done a harm to the patient, explain it. Recently I had a patient, a baby, who had a nasolacrimal duct obstruction. Probing was posted for one eye, but someone did a probing in the other eye, and there's no harm to the patient. So we talked to the patient that nothing has happened. Anyway, we'll do the next eye also, so don't worry about all this, and kept the patient comfortable. You can subtly discount the bill, but don't wave it off. The patient should not be your enemy at the time when he or she gets the bill. You should give a bill, always give a bill, but you can subtly discount it a little bit. Refer to a colleague or a higher center wherever necessary, and you please arrange the referral yourself. Don't just ask the patient to go to Madurai and do it. If you are sending to Madurai, then try to get a contact surgeon there. Find out which day the patient should be sent, and the patient should be comfortable when you are referring to another place. Now, wrong diagnosis causing complications. You can miss a vitreoretinal or a disc pathology, get a cataract done. A VR surgeon, when he is operating, sometimes might find an intraocular foreign body which has not been detected earlier. Can I take a few more minutes? Intraocular foreign body or an IOL which has been displaced in the vitreous cavity. A cataract surgeon might be missing a lens subluxation. When this happens, don't overreact. Gently tell the patient just what is essential. If the patient had an intraocular lens inside the eye, don't just make a hue and cry over that. Again, I'll tell a patient, patient came with a pseudophakic bullous keratopathy with an AC IOL and one more IOL inside. So I removed that AC IOL, then I got one more IOL removed, did an anterior vitrectomy because I didn't have much fundus view, and sent the patient away. And 4-5 months later, one of my friends from another VR surgeon from another hospital is calling me telling, Thomas, you removed an IOL from a patient. My discharge summary only had an IOL removal with anterior vitrectomy. Thomas, you removed an IOL from one patient, and now I find another IOL in the eye. I said, okay, that is the third IOL. I removed 2. But then please don't overreact to the patient and tell him that you had 3 IOLs in your eye. Just tell what is essential. Now, difficult surgical procedures, complications are expected. There could be a pseudo-exfoliation, a non-dilating pupil. Sometimes you have a bleed which is expected in a VR procedure. You could have tough membranes. These are all expected problems, but explain beforehand if necessary with photographs or drawings or anecdotes, and never scare the patient that your surgery is going to fail, so we are not going to operate you. If you are not going to operate, it's fine, but if you are going to operate, never scare the patient. You say this is a difficult procedure, but we'll do our best to see that whatever is possible can be regained. Patient should have an option of seeking a second opinion. You just don't push the patient into surgery. You advise surgery to the patient, and patient should have an option of taking another opinion. Sometimes the surgeon himself or herself can ask for a second opinion if you find that it's going to be tough. Unexpected complications you can have in uncomplicated cases. You could have a nucleus or an IOL drop, an expulsive hemorrhage. Here again, the surgeon has to explain the nature of the complication on the same day or the next day. Don't keep it for 1 month. If you had a complication today, either tell immediately after surgery or tell the patient, there are some problems, I'll tell you in detail tomorrow morning, not beyond that, and suggest remedial measures, what all can be done. This patient had this complication. There was a nucleus drop, which I am a cataract surgeon. I didn't have a vitreoretinal support in this hospital, so I'll send you to this particular person and they'll do it for you. And I'll call the doctor, get the appointment and send you. And help the patient with the right advice, and never tell the patient that it was my fault. It's never your fault. You did your best and you landed up with a complication. So it's not your fault any day. Post-operative complications, sometimes despite best efforts, you can have an endophthalmitis or an inflammation. You can have a shallow AC. You can have the IOL missing from the eye the next day. Sometimes you might have an unexpected hyphema. Explain the complication and rectify it immediately. Don't keep it for so many days. Yeah, IOL is in the eye, so don't worry. At least that first referral and handing over to the VR colleague should be done immediately, and let the VR colleague take care of that. So yourself or your colleague should explain the complication and rectify it as early as possible. If the complication is allowed to remain in the eye for a few days, talk goes around in the town that I had a complication with this particular doctor. Can I have my slide again? Time is up. Okay. Um, we had this complication, and so we'll manage it. And endophthalmitis or inflammation, never go into a denial mode. Always err on the side of endophthalmitis. Seek VR opinion if it's available in your center. If not, be in touch with a VR surgeon and refer when it worsens. Ask your colleague to assess the patient independently. And in cluster endophthalmitis, only the designated personnel should talk to the patients or relatives or the media, not anyone else. If you have a cluster of 5 or 6 endophthalmitis in your institution, every Tom, Dick and Harry should not go and talk to the patients or the bystanders. It should be designated to one person to talk to the patient, to the bystander, and if the media comes, also to the media. And have frequent in-house meetings, formulate opinions both in managing the patient and in communicating. Sometimes patients' expectations go beyond reality. There is a recurrence of macular edema after multiple injections. Visual recovery after a tough VR procedure or filtration surgery is not good. Here again, always talk science and give realistic expectations. You can say only this much percentage of patients have this, but always use anecdotes also. One of my favorite anecdotes in managing diabetic macular edema, sometimes patients ask you, doctor, in spite of 5 injections, I still have this macular edema. Idu povule. And I keep telling the patient, it's just like hunger. Every time you eat, your hunger goes away, but again it comes back. So it has to be managed lifelong. So use anecdotes. Managing complications of a colleague, be very professional. There should not be any loose talk. Don't defend your colleague too much and try give an impression that you are trying to protect your colleague, but always talk science, manage scientifically. Same thing when you have a patient walking in with complication of someone else. Don't blame or don't defend too much and manage scientifically. And the take-home messages about these communication, be well composed, take help wherever needed, refer appropriately, be compassionate to the patient, talk science and manage scientifically, and convey the message that the surgeon and the patient are not in opposite teams, but both are fighting together against this disease, and we are together. Thank you very much.
Thanks a lot, sir, for those insightful tips. So, our last talk for today is by a psychiatrist herself. When to seek the psychiatric help. Insights from a psychiatrist, Dr. Aishwarya R. Nair. She is a practicing psychiatrist at Kollam itself at NS Hospital. So she'll be talking to us on what to do when there is stress and when should you actually reach out for medical help. Thanks a lot, ma'am, for taking time for us.
Thank you, Raghi. I'm Dr. Aishwarya. I work in Travancore Medical College. So after 3 very insightful sessions, I think I will just rearrange my slides a little. And then, so what they've asked me is to talk about the pathology. When should you seek help? So 2 important things while you identify the pathology. 1, understanding the physiology. 2, trying to understand the signs of the pathology. So because of time limitation, I think we will focus on that. So what is a good mental health? Good mental health is a state in which you're able to realize your own capabilities, you're able to cope with the normal stresses of life, and you're able to work productively for yourself and people around you and make contributions to your environment and your society at large. So you can, what you can see is the word stress. So stress is something that is there in the definition for mental health also. So it's like stress, I don't like stress. I try to avoid stress, but stress follows me. So is all stress bad? Is that what we think of stress? So physiologically speaking, stress is just your body's response to challenge. So there is a positive aspect to stress that is called eustress. So like a mother told me, this is the environment I want to maintain at home for my children, is what she told me. So this is the sort of stress that brings about optimal levels of stimulation that results from challenging but attainable and enjoyable or worthwhile task. So there it is seen to have beneficial effect by generating a sense of fulfillment or achievement and facilitating growth, development, mastery, and higher levels of performance. So it can be something as simple as giving a talk. So it's not something that we do every day for a clinician. So once you've decided to do it, so you would be upskilling yourself for it. A lot of things that the prior speakers spoke about, those are things, how do you upskill yourself? Upskilling is something that we need to do throughout our life. We are all learners, especially doctors. So these are the sort of challenges that helps you upskill, and after performing it, it can be performing a dance for your conference today. So after performing it, it gives you something called mastery and pleasure. So any task that you want to perform and you've performed to your level of expectation is able to give you the energy or pleasure. And this is the energy that actually lets you move on to the next task. So that's called pleasure, mastery and pleasure. And it can increase your level of performance. So individuals maintain a fine balance between coping strategies and stressors. So when you're looking at a situation, an individual, there are three things that you have to consider. One is the individual and his coping strategies or his cognitive abilities. Next is his supportive environment. Next is the nature of stressor. Like we are saying 55 hours is stressful. I mean, I really believe it. I would get very stressed. But then you have 79-year-old Narayana Murthy talking about more work hours. So it depends on a person's capability and, as Rakhi mentioned, priority. So for a person at that point, what is his priority? How much, what is his preference or priority? And based on that, and how much are you able to pull through? That includes your intellectual capacity, your cognitive strategies, and of course your environment. You have Sudha Murthy there saying, I don't expect him to take me for movies. So it depends on your environment and of course the nature of stressor. So when does an individual go into distress? A distress occurs when the individual is unable to manage the stressor or you feel overwhelmed. It can happen, see the equation we were talking about, the individual, the environment and the nature of stressor. So based on the individual, it can be something that far exceeds your capacity. Or it can be something that you are asked to deal at a point when your resources are down. For instance, there has been a transition. You've had to deal with bereavement. You've had a failure that you didn't anticipate. Then your personal resources definitely come down. Right, so that can also be a point when you need to seek help. Next is your environment. Of course, even that has to do with your, like what Rakhi was saying, Rakhi is going through a transition. And like when you go abroad and all, so one of my mentors were telling me, the only thing they ask you in the first 6 months of the fellowship is, how are you? Have the children settled down? So transition is something that is given a lot of importance while you are transiting from one phase of your life, even a place. So that is what you mean by your environment. You don't have your support system sometimes with you. The next is the nature of stressor, the sheer enormity of the stressor, the sheer novelty, like losing a parent for the first time, or for a young person for a person who started the career, losing a patient for the first time. All these can be a reason when your stress changes into a distress. So distress occurs when the individual is unable to manage the stressor or is frankly overwhelmed. So now the other concept I would like to talk about is, prior speakers have given you a very good idea, very insightful talks on this. So that is burnout. How much time do we have? More? 10. Okay. So burnout, there are 3 aspects of burnout that I would like to explain. One was told to you by the previous speaker. The person has an energy depletion or emotional exhaustion. The second point, therefore, I would focus on the second point. That is, there is an increased mental distance. What do you mean by an increased mental distance? You don't feel like you are in charge of your work. You don't feel like, see, this is a typical, so if you ask a child, how's your exam? And he says, paper bhayangara tough arunnu. So what is the child saying? I am helpless about it. Right. If you ask a person who's alcoholic, enda kudikkunne, friends karno, what does it mean? It is a that means your locus of control over the situation, you're giving it outside. So how would it be if it happens in your workplace? So that is something what happens due to burnout. So that is something that in reality can make a person feel very helpless. So as long as you feel empowered to deal with it, you're not burnt out. And once you start feeling helpless about it, you just stop trying. So that is what an increased mental distance does to you during a burnout or when you're having a burnout. And that, of course, leads to reduced professional efficiency. Now, on the spectrum lies mental illnesses. So, some of the common things, based on the templates that we've spoken about, one is an adjustment disorder. Right? An adjustment disorder is frankly when what we talked about, the stressor, the organism, and the environment, there is an imbalance and you need help. So, that is a time when you should ask for help, and the help would be divided into two phases. One would be your pharmacological drugs that can help you. Second, during this time, what we are trying to actually do is upskill the person. So all the things that they were talking about, your time management, how do you manage your emotions, how do you communicate better? Communication would be with yourself and people around you. How do you cognitively reframe the situations? So all that would be the targets for non-pharmacological interventions or therapy. So you would be taught to, or what we would be asked to do is focus on what is modifiable in the equation and work on it. So that is the role of an adjustment disorder. Now, something that we have to keep in mind is a biological depression. So as you all might be knowing, biological depression, bipolar illnesses, all these are very much linked to our body rhythms, circadian rhythm, your interpersonal rhythms, your social rhythms. So sometimes what we see is a stress that precipitates an underlying illness, or which causes a recurrence of an underlying illness. So these are the things that we would have to keep in mind. So a rule of the thumb for that would be dysfunction. Are you not able to? So in terms of burnout, what are you saying? You're not doing as well as you should be. You're not at your optimal best. But here there can be frank dysfunction. So what we see many times when you have clinicians coming is a lot of them are able to cope with it using their cognitive abilities. But there is a point when there can be a breakdown. Another thing is untreated depression can also have a lot of cognitive sequelae. So you've had an episode of depression which has not been treated. It can. So now dementia and depression are known as precursors for each other. So that is the importance of getting a mental illness treated. So now the prevalence is, there is an increasing prevalence in healthcare professionals. So I think Sir had also spoken about it. So because of lack of time, we will just move on to the next slide. The relevance is definitely a reduction in your professionalism, quality of life, quality of care, and efficiency. So one of the most important aspects about stress management is identifying that you're stressed. So what we often see is a wife coming and complaining. Wife or someone, complaining, or a junior coming in complaining that he's losing it. Mornings are very difficult because that person just gets angry at me. But what lies beyond the anger might be an anxious surgeon, an anxious husband, or an anxious mother. Okay, so how do you identify your stressors? So what are some of the physical signs of stress? So physically it can be excessive tiredness, talking faster than usual, hyperactivity, change in appetite, change in sleep. Thoughts can be when you're in these loops of thoughts. You start thinking about it and at the end of your thought you're still there. So negative or pessimistic thinking, reduced concentration, inattention, when you're not being mindful. Behaviors depends on the person. It's like what I said before, you have an accident, a person comes out and shouts. One driver would come out and shout. That's what he does when he feels anxious. He gets defensive. Another person would crouch. That's what she does or he does when she gets anxious. You avoid. So the behavior would be an accentuation of the person's prior personality traits and also emotions. So, these are the sort of symptoms that I think we should look out for. And definitely one single word about management would be there is scope for pharmacological management and should be opted out. And definitely one thing that we all have to keep in mind is help seeking or seeking help is an adaptive quality. Human beings have never been known to be the most intelligent. We have known to be the most adaptive organisms. So help seeking is part of being adaptive. It's a sign of strength, wisdom, and professional maturity. And we don't have to wait till the breaking point. And the next thing is,
let's conclude in 2 or 3 slides.
yeah, so we'll conclude. So whom would you choose for seeking help? It can be at the level of personal, it can be a personal help or a professional help. So I think since we're nearing the end, nearing the time limit, I think we'll wind up the presentation. We'll take questions if any.
Thank you, Aishwarya ma'am, for that wonderful talk on stress management. We ourselves take stress every day in our day-to-day practice, unprofessionally, because we are not trained in doing all this, something which we have gained by our experience over the years we do, but it's all unprofessional. Thank you for putting it all in order and giving some scientific advice as to how we manage stress.
I thought the insight you gave were very practical and to the point, sir. Regarding the communication and the operation prior to, during an operation, how you would tackle it. So those are very important, and each person would excel in their coping strategy. You are, nammalana nammada coping strategy de ustad. So what you've been doing to deal with your stress goes a long way.
Any questions to Aishwarya ma'am? Or anything to contribute from your side, because all of us have been managing patients for a lot of years and we all had problems with the patients, we all had problems with our profession, our health, physical health, mental health, everything. So anything to contribute from your side? We have 1 more minute to go.
I just have a question. And I know a lot of surgeons who actually take tab Angsit, Alprax just before surgery. And it has become a routine for them. Every day before surgery, they take it, and then only they'll do surgery. Sometimes some of them will take it in between also. So what do you think? Is this a good practice, or what should you actually do?
General advice, self-medication is a slippery slope. Specific advice, benzodiazepine is a drug that can cause tolerance. So continuous use means your 0.25 will not work. Then you will have to increase the dose. Third thing, again, like I said, you're a master of your choices. If this has helped you for a long time, I think before you stop, you should definitely speak to somebody about it. And it is, I also know a couple of people who are managing just fine with it.
Here again I have something to contribute, because she said self-medication of Angsit and all. Sometimes I take bronchodilators, and the day after I take bronchodilators, I have a little bit of tremor. So if I have severe cough at night and I am about to take bronchodilators, I just run through the next day's list. Do I have a macular surgery? If so, I am not able to catch the ILM after taking a bronchodilator.
Can I make a quick comment? So you said the coping mechanism, what we do is the best. I don't think so. The perfect example is what she said, taking anxiolytic medications. Many of the time our doctors, because we are scared to go out and tell our problems, that okay, I'm feeling upset about this. I think it's very important that we must realize that we are human beings first. We should not self-treat ourselves. We should be bold enough to go to a specialist, acknowledge our feelings. I think the best thing is to be mindful of our emotions. Acknowledge them, understand that it's okay to sometimes feel jealous, upset, angry in certain situations. Acknowledge it, and if you're not able to control it with your own coping mechanisms, I wouldn't tell you to self-medicate yourself. Please go and talk to a specialist. Sometimes you just have to talk to a friend. Talking to a friend really helps. And if their friend is not a professional, it will be even better. A non-professional friend can give you the perfect advice of what you can do. Because sometimes, you are scared to open up to a professional because you think, oh, there'll be judgment. So this is my coping mechanism.
I'm glad I got I got an opportunity to clarify. What I meant by your coping mechanism is, see, pranayama is something that works for her.
Yeah.
Going to a temple is something that works for another person. Going to a gym is something. So what you've done is you've put years of practice into it. And that has become good and useful for you. But all those symptoms and signs that I was saying should be your indicators that you are feeling overwhelmed.
Yes.
And it's time for you to seek personal or professional help.
I totally
And
agree.
self-medication is definitely a slippery slope. I don't know whether I miscommunicated. I wasn't advocating that.
Yeah, I didn't
Thanks
listen-
for bringing it
I
up,
didn't
ma'am.
listen to your talk, but it's just
Yeah.
my perspective I wanted to share.
Thank you. I think
And
that was an
Dr.
amazing
Samarapuri,
point.
regarding this, I'm working in a teaching institute. We plan for once in a 6 months for one-day trip. All our colleagues with family. That definitely helps a lot of problem, stress relief.
That's amazing that there are people who are actually putting in thought, who are putting in time and organizing it. Absolutely wonderful, sir.
Thanks a lot everyone for being here. Thanks a lot Dr. Aishwarya. So I would now request Dr. Thomas Cherian sir to please hand over the memento to our invited guest speaker, Dr. Aishwarya R. Nair.